Hi, I'm Flora Kaplan. I'm the Indicators Program Manager, and I'm going to review some of the updates that we did for this fall. We organize our research into 3 different categories: economy, equity, and the environment. So to start off, I'm going to talk about the median household income for 2015 that increased 0.22% from 2014, whereas across California and across the nation, median income increased by 4% in the same time period. So in 2014, San Mateo County had the highest median income, but not in 2015. We got surpassed by Santa Clara County. But the good news is that our unemployment rate fell to 3.4%, which is the lowest in the 9-county Bay Area. Yay. Conversely, when we look at poverty, the poverty rate in California and the U.S. dropped, whereas despite our increase in median income in San Mateo County, our poverty rate increased by 16% between 2014 and 2015. So it's now at 8.5%, although it's still one of the lowest rates in the Bay Area. I have our chart here for child poverty, and the way that we measure that is looking at the rates of poverty for families that have children under the age of 18. And so we see that San Mateo County definitely has a lower rate of child poverty than California, but the rate still did increase this year along with the general poverty rate, and we see that the poverty is more common for families that are headed by single females. These numbers are based on the federal poverty level, which doesn't account for local variations in the cost of living. So it can potentially underestimate the number of people living in poverty in expensive areas like San Mateo County. And the commute. We compared the commute numbers from 2015 to 2013, and we found that the number of people who work from home increased by 25%, while the number of commuters who drive alone decreased by 3%. So that's a great advance. Also, in this small other category that only is 3% of the population, this increased by 50% over those 2 years, and it includes bicyclists, over 5,000, and motorcyclists, over 800. We also updated our research on solid waste, and we found that the number of pounds of solid waste disposed in the county increased 6% from the prior year. Now, this is partially due to population growth as well as an increase in business-related disposal, for example, construction. And there's also been enhanced recycling programs, and recycling is included in these disposal numbers because it's a major part of the waste stream, and it takes considerable resources to transport these recyclables and then transform them into something else. Consider that in 2014, 18 million tons of recyclable material were exported from California overseas. Another part of this waste stream is food waste, and across the U.S., food waste is the single largest waste stream in landfills. And there was a recent study by Rethink Waste, a local organization, and they looked at one particular gathering station, and they found that 24% of residential trash consisted of compostable food waste, and the rate for commercial customers was actually 6% higher. So when food waste goes to a landfill, it generates methane gas as it decomposes, and that's released into the atmosphere. And this methane gas accounts for approximately 18% of landfill emissions across the U.S., and landfills are the 3rd largest source of emissions, so this is a serious concern. So I just want to encourage you to think about this when I talk later about food waste. So moving on to our key indicator, this is our final update for our year-long look at our local food system. And I'm going to talk a little bit about the about healthy food, about the food environment in San Mateo County, and then a little more about food waste. But we have a lot more information on our website and also in our printed report, so I encourage you to take a look at both of those. So on the topic of healthy food, we all know that the food choices that we make every day affect our health, but to be more precise, research has found that eating healthy food reduces your rates of cardiovascular disease, diabetes, certain types of cancer, and weight gain. Here we looked at data from the San Mateo County Health System, and we see that the overall rate of diabetes is 10%, or was 10% in 2013, which is a 150% increase from 1999. So that's a really big number. It was 4% the population had diabetes in 1999, and then we went up to 10% in 2013. One of the many negative health impacts of diabetes is that you're 50% more likely to have a heart attack if you have, or to die of a heart attack if you have diabetes. So we see from the data that income and education are probably the biggest indicators of whether someone's going to have diabetes or have obesity. Obesity increased by 96% in between 1999 and 2013. And then the number of people who are overweight but not obese actually decreased by 13%. Any discussion about healthy food choices needs to consider the food environment, because it basically makes food decisions for us, especially for those of us who have limited transportation or time to shop for food. This means children at school, low-income populations that have less access to transportation, or the elderly or the disabled. And overall, San Mateo County is considered a food swamp, meaning that there's a lot of options for not so healthy food, maybe food that's highly processed. And then we have a number of areas that are highlighted on this map that are food deserts or have low access to healthy food. And a food desert is characterized as having to travel over a mile to access healthy food. And we got this data from the USDA Economic Research Service to create this map. The food deserts are shown in red. And we have one that I believe is in the Bellhaven neighborhood that's just north of East Palo Alto. And then we also see another one around Brisbane, close to the Cow Palace. The areas shown in orange on this map, and this map is on our website as well, those are just low accessibility areas where you have to travel over a half mile in order to reach a supermarket or a place where you can buy fresh fruit and produce, low-fat dairy, meat products, or whole grain foods. Those are what are considered to be healthy foods. And so some of the areas that are low access are North Fair Oaks, and San Bruno has a few pockets, Colma, Daly City. Now, while a significant number of people are food insecure, 40% of food produced in the U.S. goes to waste. It's a pretty staggering number. This problem has gained a lot of attention by the USDA and the EPA, and it's resulted in this public awareness campaign. You see this great diagram of encouraging people to reduce food waste. Their goal is to reduce food waste by 50% by 2030. In a ReFed report, which I encourage everyone to read, it's really fascinating, they found that 40% of food waste is produced by customer-facing businesses, meaning grocery stores, restaurants, and other institutions, and the remaining 43% is discarded in homes. So that means that consumers, all of us, have a great opportunity to prevent food waste by planning our meals in advance of shopping, changing our food storage habits, and donating unwanted food. I mentioned a study that was done by Rethink Waste at a local waste station recently, and in that study they found that there were unopened packages of food, beverages, and beer. And this is very common. It wasn't a one-time thing. Across the US, you'll see unopened food in our waste stream. And it's likely because the dates on food packages are a little misleading. So on our website, we have some further explanations of those dates so you can see that you don't necessarily need to throw food away, or maybe you can donate it rather than tossing it. And the estimate is that this loss of edible food accounts for 20% of the food waste at home, as throwing away this food that you think is expired, but it's maybe still good to eat. So this concludes our review of the indicators. I'd like to thank you for your time.